Hi, I'm Elise Weiss, the president of Lamaze International, and I'm here to talk to you today about the most recent ACOG committee opinion on evidence-based practice and the gaps in care. So ACOG's recent guidelines point out that the care that women receive is not always based in evidence. The Institute of Medicine talks about how it takes 17 years for research to go from what we call the bench, where we're doing the research, to bedside, meaning patient care. Your pregnancy is only 40 weeks long. So what's unique here is that ACOG is actually pulling this out and flagging it as an issue. They understand that this is something that their practitioners need help with, and this is where you come in. This is a chance for you to push for your baby and get better care. Healthcare professionals have an important role in closing this gap. One of the things that you need to know is your choice of practitioner is very important to the health and safety of your pregnancy and birth. Oftentimes you will start asking questions with your practitioner, and this can start early in pregnancy, but as you learn more, you will ask harder and harder questions. As you get this information, you may find that you feel uncomfortable with your practitioner. So if you're feeling uncomfortable with your practitioner, don't hesitate to shop around and find someone else. It's easier to do early in pregnancy, but definitely something that you can do even later in pregnancy. So the best way to push for a healthy birth is to have these 6 simple steps that Lamaze calls the 6 healthy birth practices. The first one is to let labor begin on its own. The second one is to move, walk, and change positions throughout labor. Number 3, bring a loved one, friend, or professional labor support such as a doula with you. Number 4, avoid routine interventions that are not medically necessary. For example, continuous electronic fetal monitoring and cesareans. Number 5, avoid giving birth on your back and follow your body's natural urges to push. Number 6 is keeping mom and baby together, and keeping them skin to skin is best. The 6 healthy birth practices are based on evidence. We routinely review the evidence to make sure that they are up to date and up to our standards. We do this so that you can have a healthy, safe birth and have the confidence to know that these 6 healthy birth practices are exactly what you and your baby need. Use the 6 healthy birth practices to start conversations with your practitioner to make sure that you can push for your baby to have the birth that you want to have. Knowledge is power. Taking a Lamaze class is a great way to get the knowledge that you need to help you and your baby have a safe birth. To learn more, you can find the 6 healthy birth practices and your very own LCCE at lamaze.org.